Hello everyone. So today we will discuss about interior of the skull. The objectives are to learn about interior of the skull, the interior aspect of the vault, anterior cranial fossa, middle cranial fossa, posterior cranial fossa, the attachments and foraminae in this region and the clinical anatomy. So the interior of the skull will learn under the vault, which is also known as the skull cap. The exterior of this we have learned in the norma verticalis. So here we learn about the interior of the vault and also the interior of the base. So the interior of the base can be divided into the anterior cranial fossa, the middle cranial fossa and the posterior cranial fossa. So the cranium is lined internally by the endocranium, which is continuous with the pericranium through the foramina and the sutures. So the thickness of the cranial vault is variable. Most of the cranial bones consist of the outer table of the compact bones. It is thick, resilient and tough, and inner table of the compact bone, which is thin and the brittle. So in between that, the diploids that consists of the spongy bones filled with red bone marrow is present, that is between the outer table and the inner table. So the cranial cavity or the interior of the skull lodges the brain. The anterior cranial fossa lodges the frontal lobe, the middle cranial fossa lodges the temporal lobe, and the posterior cranial fossa lodges the cerebellum and the pons and the medulla in the anterior aspect. Now the interior of the vault. The bones present here are the frontal bone, the parietal bone, the occipital bone. Between the frontal bone and the parietal bone, we are having the coronal suture, and between the two parietal bones, we are having a sagittal suture. So we can appreciate in the outer aspect of the vault better, and at the junction of the coronal suture and the sagittal suture, the meeting point is called the bregma, and the meeting point of the parietal bone and the occipital bone is called the lambda. So we have seen the skull is mainly made up of the outer table and the inner table. So the inner table is thin and it presents a markings produced by the meningeal vessels, venous sinuses, arachnoid granulations and some of cerebral gyri. The frontal crust lies anteriorly in the median plane. It projects backwards. The granular foveae are deep, irregular, large pits situated on each side of the sagittal sulcus. They are formed by the arachnoid granulations. They are larger and more numerous in the aged persons. And we can observe the vascular markings, the groove for the anterior branch of the middle meningeal artery and accompanying veins. It runs upwards 1 centimeter behind the coronal suture. So we can make out these branches in the parietal bone also, and it is extending towards the anterior aspect also. And the parietal foramina opens near the sagittal sulcus 2.5 to 3.75 centimeter in front of lambdoid suture. Here we couldn't make out it properly. Then the sagittal sulcus runs from before backwards in the median plane. So in the anterior aspect it is narrower and then it progressively becomes wider as it is going towards the posterior aspect. So now we will learn about the internal surface of the base of the skull. So we have seen it is divided into three subdivisions. the anterior cranial fossa, middle cranial fossa and the posterior cranial fossa. The dura mater is firmly adherent to the floor of the fossae and it is continuous with the pericranium through the foramina and the fissures. So, now the anterior cranial fossa, boundaries anteriorly it is formed by the frontal bone. Then on the lateral aspect we can see the lesser wing of the sphenoid. The lesser wing of the sphenoid, if you trace it posteriorly, there is a projection that is called the anterior clinoid process. Then at the center we are having the sulcus chiasmaticus. The floor is formed in the median plane by the cribriform plate of ethmoid bone, the posteriorly by the jugum sphenoidale, that is the anterior part of the body of the sphenoid. So, the orbital plate of the frontal bone on either side, we can see the orbital plate of the frontal bone and it is completed posteriorly by the lesser wing of the sphenoid. So, in the median plane we are observing the cribriform plate of ethmoid and the anterior aspect of the jugum sphenoidale. On lateral aspect there is a orbital plate of the frontal bone and the lesser wing of the sphenoid bone. So, at the median plane there is a cribriform plate of ethmoid bone that separates the anterior cranial fossa from the nasal cavity. It is quadrilateral in shape. The anterior margin of this articulates with the frontal bone at the frontoethmoidal suture. So, here we can observe the suture formed by the anterior margin of the cribriform plate of bone with the frontal bone. And the foramen cecum is present in the median plane. So, usually this foramina is blind, but sometimes it may be patent. The posterior margin of the cribriform plate articulates with the jugum sphenoidale. So, here at the junction of the cribriform plate and the frontal bone we can appreciate the anterior ethmoidal canals. So, the cribriform plate of ethmoid bone posteriorly it articulates with the jugum sphenoidale and at the corners it can show the posterior ethmoidal canals. So, anteriorly we are having a pair of anterior ethmoidal canals and posteriorly we are having the posterior ethmoid canals. And the lateral margins are articulate with the orbital plate of the frontal bone. The sutures between them that only forms the anterior ethmoidal canal. So, here we can see the lesser wing of the sphenoid which is forming the posterior border of the anterior cranial fossa. It is broad medially and that is continuous with the jugum sphenoidale medially, and the free posterior border fits into the stem of the lateral sulcus of the brain. The crista galli is situated at the center. Then there will be a foramina of olfactory nerve rootlets we can make out in the cribriform plate of ethmoid bone. Then the body of the sphenoid at the median plane it is called as the jugum sphenoidale. It separates the anterior cranial fossa from the sphenoidal sinuses. So, again the lesser wing of the sphenoid bone which ends posteriorly into a pointed projection known as the anterior clinoid process. So, inferiorly the posterior border forms the upper boundary of the superior orbital fissure. So, here we can see the lesser wing of the sphenoid bone. It is forming the upper boundary of the superior orbital fissure. Then above, that is medially, the lesser wing is connected to the body of the sphenoid by the anterior and the posterior roots that encloses the optic canal. The clinical aspect, the fracture of the anterior cranial fossa leads to the bleeding and discharge of the cerebrospinal fluid through the nose. The black eye produced by the seepage of blood into the eyelid. Now, the middle cranial fossa, it is deeper than the anterior cranial fossa and is shaped like a butterfly. It is narrow and shallow in the middle and wide and deep on each side. The boundaries anteriorly, it is bounded by the posterior border of the lesser wing of the sphenoid, the anterior clinoid process, the anterior margin of the sulcus chiasmaticus. Posteriorly, it is bounded by the superior border of the petrous temporal bone, the dorsum sellae of the sphenoid bone. Laterally, the greater wing of the sphenoid bone, anterior, that is antero-inferior angle of the parietal bone, and the squamous temporal bone. The floor is formed by the body of the sphenoid bone in the median region and the greater wing of the sphenoid, the squamous temporal bone, the parietal bone on each side. So, the features present in the median area. So, it presents the sulcus chiasmaticus or the optic groove that leads on each side to the optic canal. The optic canal that leads to the orbit, it is bounded laterally by the lesser wing of the sphenoid, in front and behind by the two roots of the lesser wing of the sphenoid, and medially by the body of the sphenoid. Then the sella turcica or the pituitary fossa. It is bounded above by the tuberculum sellae, and at the center you can see the hypophyseal fossa, and below it is formed by the dorsum sellae. So, the tuberculum sellae, it presents the optic groove from the hypophyseal fossa. Its lateral ends form the middle clinoid process. So, here we can make out the middle cranial process. Sometimes it may join with the anterior clinoid process. Then the hypophyseal fossa, it lodges the hypophysis cerebri. So, beneath the floor of the fossa, there will be presence of the sphenoidal air sinus. The dorsum sellae is a transverse plate of the bone projecting upwards. It forms backwards and extended to form the posterior clinoid process. So, the anterior clinoid process is the downward projection of the lesser wing of the sphenoid. Then the middle clinoid process is extending from the tuberculum sellae, and the posterior clinoid process is extending from the dorsum sellae, but it is projecting upwards. Now, the features in the lateral area. The lateral area is deep and lodges the temporal lobe of the brain. So, it is related anteriorly to the orbit, laterally to the temporal fossa, and inferiorly to the infratemporal fossa. So, superior orbital fissure, it opens anteriorly into the orbit. It is bounded above by the lesser wing of the sphenoid, below by the greater wing of the sphenoid, and medially by the body of the sphenoid. So, when we observe, the medial end is wider than the lateral end, and the lower border forms a projection. A tendinous ring of zin is attached to along this ring and divides it into 3 compartments. Then the greater wing of the sphenoid bone presents the foramen rotundum, foramen ovale, which lies posterolateral to the foramen rotundum. It leads inferiorly to the infratemporal fossa. The foramen spinosum lies posterolateral to the foramen ovale. It leads inferiorly to the infratemporal fossa. Then the foramen lacerum, it lies at the posterior end of the carotid groove, posteromedial to the foramen ovale. So, from above downwards we are having the foramen rotundum, foramen ovale, foramen spinosum, and towards the medial aspect there is a foramen lacerum. So, the anterior surface of the petrous temporal bone, it presents the trigeminal impression which lies near the apex behind the foramen lacerum. So, it lodges the trigeminal ganglion. Then behind that there is a hiatus and the groove for the greater petrosal nerve, and behind that there is a elevated part that is called the arcuate eminence. So, here we can make out the arcuate eminence that is produced by the superior semicircular canal. The tegmen tympani, it is a thin plate of bone anterolateral to the arcuate eminence. It forms a continuous sloping roof for the tympanic antrum, for the tympanic cavity, and for the canal for tensor tympani. So, the cerebral surface of the squamous temporal bone is concave. So, here we can observe the squamous temporal bone. So, it shows the impressions for the temporal lobe and grooves for the branches of middle meningeal vessels. The clinical aspect, the fracture of the middle cranial fossa produces the bleeding and discharge of cerebrospinal fluid through the ear, bleeding through the nose or mouth due to involvement of the sphenoid bone. The 7th and 8th cranial nerves may be damaged if the fracture extends to the internal acoustic meatus. So, now the posterior cranial fossa, it is the largest and deepest of the 3 cranial fossae. The posterior cranial fossa contains the hindbrain that consists of the cerebellum behind and the pons and medulla in front. So, the boundaries anteriorly the dorsum sellae of the sphenoid bone and the superior border of the petrous temporal bone. On the posterior aspect, the squamous part of the occipital bone. On each side, the mastoid part of the temporal bone and the mastoid angle of the parietal bone. The floor is formed in the median area by the clivus, that is the sloping area behind the dorsum sellae. So, that is called as the clivus, the foramen magnum in the middle and the squamous occipital behind. The lateral area of the floor consists of the condylar part of the occipital bone, the posterior surface of the petrous temporal bone, the mastoid temporal bone, the mastoid angle of the parietal bone. So, other features in the median area, that is clivus, it is a sloping surface in front of the foramen magnum. It is formed by the fusion of posterior part of the body of the sphenoid including the dorsum sellae with the basilar part of the occipital bone or the basi-occiput. So, this is related to the basilar plexus of veins and it supports the pons and medulla oblongata. The foramen magnum, it lies in the floor of this fossa. The anterior part of the foramen is narrow and posterior part is widened. The squamous part of the occipital bone is present in the posterior aspects. So, in the squamous part we can observe the internal occipital protuberance. So, again we are observing the foramen magnum, the squamous part of the occipital bone, the internal occipital protuberance, and here we can observe the internal occipital crest that runs in the median plane from the internal occipital protuberance to the foramen magnum, where it forms a shallow depression, the Vermean fossa. The fossa for the cerebellar hemispheres we can observe on either side. The transverse sulcus, it is wide and runs laterally from the internal occipital protuberance to the mastoid angle of the parietal bone. So, the jugular tubercle we can observe in the lateral aspect. The condylar or the hypoglossal canal that pierces the bone antero-posterior to the jugular tubercle. The internal acoustic meatus, which is present in the posterior surface of the petrous part of the temporal bone. It opens above the anterior part of the jugular foramen. So, measures about 1 centimeter long. Then this is the jugular foramen. It lies at the posterior end of the petro-occipital fissure. The upper margin is sharp and irregular. The lower margin is smooth and regular. The mastoid part of the temporal bone forms the lateral wall of the posterior cranial fossa behind the petrous part of the bone. So, anteriorly we can observe it is marked with the sigmoid sulcus, that is grooved area, which lodges the sigmoid sinus. So, now the clinical anatomy. The fracture of the posterior cranial fossa causes the bruising over the mastoid region extending down over the sternocleidomastoid muscle. So, now we will learn about attachments. Attachment of the vault. The falx cerebri is attached to the frontal crust. So, here we can observe the sagittal sulcus. The border gives attachment to the falx cerebri. So, the falx cerebri anteriorly it is attached to the frontal crust and again it extends backwards. So, the lips of the sagittal sulcus also gives attachment to the falx cerebri. So, the attachments in the anterior cranial fossa. The falx cerebri is attached to the crista galli. Then the frontal lobe of the brain is supported by the orbital surface of the frontal bone. The tentorium cerebelli is attached margin of the tentorium cerebelli is attached to the anterior clinoid process. That is the anterior clinoid process gives to the free margin of the tentorium cerebelli. The attached margin is attached along the superior border of the petrous temporal bone. So, now the middle cranial fossa. So, the temporal lobe is occupied in the middle cranial fossa. The diaphragma cellae is attached to the tuberculum cellae. The hypophysis cerebri is lodged in the hypophyseal fossa. The diaphragma cellae is attached to the dorsum cellae. The cavernous sinus lies on each side of the body of the sphenoid. Then the superior petrosal sinus lies along the superior border of the petrous temporal bone, and along with that the tentorium cerebelli, the attached margin of tentorium cerebelli is also we can see along the superior border of the petrous temporal bone. Then the trigeminal nerve gives a grooved impression on the medial part of the superior petrosal bone. And the attachments in the posterior cranial fossa. The posterior cranial fossa contains the hindbrain that consists of the cerebellum behind and the pons and medulla in front. So, the apical ligament of the dens is attached to the lower part of the clivus. Clivus is the sloping part. So, at the lower part of this clivus, the apical ligament of the dens is attached near the foramen magnum. So, the upper vertical band of cruciate ligament and the membrana tectoria, they are attached just above the apical ligament. The falx cerebelli is attached to the internal occipital crust. So, now we will observe the structures passing through the foramina in all the three fossae. The first anterior cranial fossa. So, the foramen cecum usually it is blind, sometimes if it is patent it can transmit a vein from the upper part of the nose to the superior sagittal sinus. The posterior ethmoidal canal transmits the posterior ethmoidal vessels. The anterior ethmoidal canal transmits the corresponding nerves and the vessels, that is the anterior ethmoidal vessels and the nerves. The optic canal transmits the optic nerve and the ophthalmic artery. So, here we can make out the optic canal and the superior orbital fissure. So, in the lower border of the superior orbital fissure there is a elevation, so to which the tendinous ring is attached and divides the supraorbital fissure into three compartments. So, here we can observe the tendinous ring that is dividing the superior orbital fissure into three portions. So, the lateral part passes the lacrimal nerve, frontal nerve and the trochlear nerve. So, we can remember LFT, that is lacrimal nerve, frontal nerve and trochlear nerve. Along with that the superior branch of ophthalmic vein. So, the lateral part consists of LFTS, the lacrimal nerve, frontal nerve, trochlear nerve and superior ophthalmic vein. So, in the middle part we are having superior branch of oculomotor nerve, nasociliary nerve, the abducens nerve and the inferior branch of oculomotor nerve, that is the superior and inferior branch of oculomotor nerve, the nasociliary nerve and abducens nerve. So, we can remember ONA. Then in the medial part we are having the inferior branch of the ophthalmic vein and the sympathetic nerves from the plexus around the internal carotid artery. The maxillary nerve through the foramen rotundum, the maxillary nerve passes, and the foramen ovale transmits the following structures: the mandibular nerve, accessory meningeal artery, the lesser petrosal nerve and emissary vein. Already we have discussed in the base of the skull, just we will revise. Okay. So, in the foramen ovale, MALE, the structures passing through the foramen ovale is mandibular nerve, accessory meningeal artery, lesser petrosal nerve and emissary vein. And through the foramen spinosum, that is 3 M's, the middle meningeal artery, meningeal branch of mandibular nerve and the middle meningeal vein. And through the internal acoustic meatus, the cranial nerves, 7th and 8th cranial nerves passes through this internal acoustic meatus, and also the labyrinthine vessels are also passes through this. So, through the jugular foramen, so the jugular foramen, through the anterior part the following structures will pass, that is inferior petrosal sinus, meningeal branch of ascending pharyngeal artery, and through the middle part 9th, 10th and 11th cranial nerves, and through the posterior part of the jugular foramen the internal jugular vein, meningeal branch of occipital artery passes. And in the anterior aspect of the foramen magnum, the following structures are passes, that is the apical ligament of the dens, vertical band of cruciate ligament and the membrana tectoria. And in the posterior aspect, the lowest part of the medulla oblongata and the 3 meninges. So, through the hypoglossal canal, we are having the following structures, that is hypoglossal nerve, meningeal branch of hypoglossal nerve, meningeal branch of ascending pharyngeal artery, then emissary vein. So, the question for the assignment, the foramen ovale, structures passing through it, the foramen spinosum, superior orbital fissure, boundaries and structures passing through, then jugular foramen, foramen magnum, and the named foramina in the middle cranial fossa. Thank you.